If I have rheumatoid arthritis and I'm using biological treatment, can I stop biological treatment someday? This is a question that many rheumatoid arthritis patients will ask. What is the answer to this question? First of all, I would like to clarify, why do we start biological treatment for patients with rheumatoid arthritis? When we prescribe treatments for patients with rheumatoid arthritis, we either use non-biological treatments, we call them the conventional DMARDs, or we use biological treatments. We usually start with the non-biological treatments. They are, we have more experience with them. They are effective enough in many patients, not all, but many patients, and they are enough to get the patient into a state of remission. But if this doesn't happen, we go for the biological treatments, which are more potent than the non-biological ones. The problems when we prescribe biological treatments is that they are very expensive. If you don't have money and if you don't have insurance, you have a problem availing those medications. The second one, patients usually are very scared of biological treatments. They assume that they must have severe side effects that would prevent continuing on those treatments. So what we want to tell to patients, biological treatments are more potent treatments than the non-biologicals, but they don't have so many adverse effects than the non-biologicals. They are very comparable. The profile of the side effects is very comparable between both entities. The two most important questions that patients ask when we prescribe biological treatments are: is this a final treatment? Is this an end to the disease? If I receive 1 or 2 shots or if I receive a course of this biological treatment, this is the end of my disease? This is one question. The second question, am I going to be on this medication for life, or there will be a time when I can stop this medication? Well, the answer to the first question, is this an end to the disease? This is not true. This is not a final treatment. This is not the end of the disease. This is not a course and that's it. This is a chronic disease and this is a continuous treatment. But with some exceptions, and as we will explain now. The second question, am I going to be on that treatment for good? Theoretically, you should be on treatment for good. But practically, there is a chance that we might stop this treatment, decrease the dose, or stop that treatment someday. How? If you improve on the treatment, whether biological or non-biological even, if you improve on the treatment, what the doctor will do is that he will start to decrease the doses of your medication. And if all goes well and you're tolerating this and there's no activity of the disease that emerging with this decreasing of the doses of the treatment, we decrease further. And we keep on decreasing further so long as it is tolerated. So, and if conditions are under control, we will consider stopping the treatment someday. If we stop the treatment, one of two things will happen. One, after 3 or 4 or 10 months, your disease activity starts again and we restart treatment again. Or 2, nothing happens, everything is under control, you never get a flare again, as if you are cured of the disease, as if you're cured of the disease. This video is about when and how the doctor will decrease the biological treatment. If you feel better on the treatment, then the doctor will start to have a plan to decrease doses of treatments in general. What is the definition of the patient has improved on treatment? For the patient, it means I feel better. But for the doctor, things are more organized than that. For me as a doctor, it means that the severity of the pain that you feel is less, the stiffness of the joints in the morning is less. On examination, the tender joints and the swollen joint counts are less, and the lab parameters, the lab tests that show inflammation are better. And we have more conditions for improvement. We have a station called low disease activity, and it means certain figures of improvement, and we have another station called remission. You don't have any symptoms, no signs on examination, and the lab tests that show inflammation are normal. Okay. If the patient improved according to what doctors classify, or according to the criteria of doctors. And he was on a biological treatment. What are you going to do now? First of all, if you are on cortisone, if you are on prednisolone or corticosteroids, this is the first thing that we remove from our way. We decrease the dose, hoping that we can stop it completely if the patient is on steroids. After that, we start to consider the biological treatment, how we can decrease it. The non-biological treatment, if it is also prescribed to the patient, we don't consider this now. We just think of the biological treatment now. Decreasing the biological treatment doses. At a time when we, doctors, we have rules and regulations for prescribing medications and for increasing the doses of medications, we don't have really strict or clear rules for decreasing the doses of medications, especially biological medications. So it mostly depends on the experience of the physician and or the sporadic articles that have been published by other physicians who have the same experience. When we decrease biological medications, we do one of two things. Either we space out the doses, we increase the distance between the doses, or we decrease the dose of one individual shot of the treatment. Increasing the dose, the distance between the doses. This means that if you are maintained on a treatment on a weekly injection, like Enbrel weekly, we will increase the dose instead of 7 days to 9 days. And if all goes well, we go to 11 days. If all goes well, we go to 2 weeks maybe. All goes well, it also has to be many weeks. 2 months, 3 months, it has to be a duration. We don't just keep on escalating the distances. If you are maintained on a treatment that you receive every 2 weeks, like Humira, like Cimzia, then you, instead of 2 weeks, you will go for 17 days, then 19 days, then 3 weeks, maybe more. If you're in a treatment that you receive every month, like Symphony, like Actemra, like Cimzia also sometimes, we make it every 5 weeks, we make it every 7 weeks, we make it every 2 months, and so on. Decreasing the dose in an individual shot. This is possible for those treatments where you have the ability to do this. It's mostly the infusions like the Actemra and the Remicade. There are variations between doctors in the strategies of decreasing biological treatments. Some of them will increase the distance between the two doses, and some of them might go for decreasing the individual dose. My personal experience is that it is much safer to increase the distance between the doses, but always keep the dose the same as it is without decreasing it. It's also different. The patients vary a lot in your ability, in how far you can reach. Also, patients vary a lot in how far you can reach when you go for spacing out. Sometimes you have a ceiling that you cannot exceed, like there's an injection that you receive every 2 weeks. The maximum that you can go is make it every only 19 days. For other patients, you can keep on increasing the distance, the time between the doses until eventually you stop the medication. It is not advisable that you go for spacing out or decreasing the doses on your own at all. This is something that should be done through your doctor, because the assessment of your doctor for the good timing is different than the assessment of the patient always.